We have now administered more than 3.1 million doses of COVID-19 vaccine in our province. 67% of all Albertans 12 years of age and older have at least one dose, and 15% are fully vaccinated with 2 doses. Over the last 24 hours, we have identified 139 new cases of COVID-19 and completed about 3,400 tests. Our positivity rate was about 4.2%. Last week, the R value for the province was 0.74. This includes 0.75 in the Edmonton zone, 0.73 in the Calgary zone, and 0.73 for the rest of the province. These are great numbers, signs that our efforts to reduce the spread of COVID-19 are working. We continue to screen all positive samples for variants of concern and have identified 74 additional cases in the last 24 hours. There are currently active alerts or outbreaks in 241 schools, representing 10% of the schools in the province. There are 336 people being treated for COVID-19 in hospital, including 85 in the ICU. Sadly, I must announce that 3 new deaths were reported to Alberta Health in the last 24 hours. They were between the ages of 48 and 68. My thoughts are with the family and friends of these Albertans as they mourn their loss. I also extend my sympathies to anyone who has lost a loved one recently from any cause. There are currently 4,431 active cases in the province, the lowest we've seen since March 9th. That's over 20,000 fewer active cases than we had just 1 month ago. What's more, our positivity rate has averaged 4.5% over the last 7 days. That's a sharp drop from the average of 11.7 in early May. Most importantly, Alberta's average positivity rate is declining in all zones, which indicates that progress is being made province-wide. All of this tells us that our growing immunization program and our public health restrictions are working together as planned and limiting transmission. I know there have been some questions recently about the B.1.617.2 variant, also known as Delta, and I want to talk about what this means for our province. This variant is not new to our province. We identified our first case in a sample taken on April 8th. Since then, we have identified 193 cases of this B.1.617, which was originally identified in India. The majority are most likely the substrain B.1.617.2. We also know that BC and other provinces are seeing cases of this variant even as their overall numbers continue to fall. Right now, AHS has identified 16 cases of this particular variant in patients on 2 units at the Foothills Medical Centre. 4 healthcare workers have also tested positive. These are 2 separate outbreaks, and most cases are experiencing mild COVID-19 symptoms. It appears that all but 1 case are hospital-acquired, so cases were in hospital for other reasons before their infections. As with all other outbreaks in acute care settings, AHS has implemented strict outbreak protocols to protect the health of everyone involved. The good news is that these protocols are working. There have been no new cases on one of these 2 units since May 20th. The hospital remains open for patients and safe for those receiving care. We are seeing that 70 to 80% protection from the first dose for the vast majority of the COVID-19 virus strains that are circulating in the province right now. And so we want to make sure we're giving people the opportunity to take advantage of that protection, that 70 to 80% protection, at the same time as knowing that the second dose solidifies that, increases it to 90% or more, and particularly for this particular B.1.617 variant, increases even further as that first dose doesn't seem to achieve that 75-ish% protection that we do see against some of those other strains. So again, it's taking into account that encouragement for first doses and then using available appointments to accelerate, as we're able, those second dose opportunities for people, but wanting to make sure we're balancing both of those things, because those who haven't yet had the chance to access that protection for themselves and others of that first dose, we want to make sure they have every opportunity to do so. I think that we have been, again, in an unprecedented time. Most of us have never lived through the kind of disruption that we've lived through in the past 15 months. And it's totally natural to look at the measures that have been in place as the only things that provide us safety from COVID-19. And the plan that was built was laid out on looking at other jurisdictions, looking at the experiences that other jurisdictions have had after opening at different levels of protection, and then building that into the Alberta context. And so I think, again, it's important to move forward on this together. The fact that many of the CMOH orders will be lifted in stage 3 doesn't mean that COVID-19 goes away. COVID-19 is something that will be managed as we manage many infectious diseases at a local level with public health expertise in our public health teams. And that kind of infrastructure stays with us and doesn't go away even after these extraordinary measures are lifted.